are the reasons for having to stay in a hospital during your pregnancy overnight in a maternity unit for? And if you had to stay during your pregnancy, let me know in the comments what you stayed for and how long you had to stay for. So many women do develop complications during pregnancy, and there are certain conditions where, as midwives, as doctors, we will recommend that you stay overnight for. This is for one of two reasons. Either firstly, you have a medical condition that needs treating, for example, something like preeclampsia, or alternatively, whatever it is that you have puts you at greater risk of either going into labour or potentially needing a maternity theatre very quickly. Now, the most common reason for being admitted during your pregnancy is an induction of labour into a maternity unit ward. However, this is not an emergency. Outside of having an induction of labour, threatened preterm birth or suspected preterm birth is the next most common reason for being admitted. This is where there might be cervical changes, so your cervix is starting to open, soften in a face. Maybe your waters have gone, maybe you've got abdominal pain, contractions, or you might have had a positive fetal fibronectin or actin partus. And the reason for staying is so that you can be monitored, that if you went into labour and had a preterm baby, you're in the right place in the right time with the right doctors who can help your baby because they're premature. The second most common reason is preeclampsia or high blood pressure. So if your blood pressure is not able to be stabilised in your assessment units, in your triage units, and it's quite significantly raised, if you've got preeclampsia and your bloods are positive to that, then sometimes an admission will be recommended. Now, the longest time I've ever known a woman to be admitted for, she was admitted at 22 weeks and she stayed until she was 34 weeks. She actually self-discharged herself for 2 hours over Christmas Day so she could see her other children. And this was because of recurrent bleeds during pregnancy. So any woman having vaginal bleeding during pregnancy will often be recommended to stay in a maternity unit to observe and see what happens. Now, for women who have got a placenta previa, that's where the placenta is covering the cervix. I've done videos on that before. What happens is they can recurrently bleed as it moves up. However, if that bleeding doesn't stop, you need to be very close to a maternity theatre where a caesarean birth can potentially be performed. Placenta previa is increasing because of the increasing caesarean birth rate, IVF rate and uterine surgery rates. Placenta previa is normally the reason behind a long hospital stay during pregnancy. If there is no bleeding at all during pregnancy, then some women will be admitted around about 36, 37 weeks prior to their caesarean birth date, just in case. It may also depend on the grading of the placenta previa, whether it's a 1 or a 4 as well, which can have an impact as to whether you'll be recommended to stay or not. And another reason for staying in a maternity unit is unstable lie. So baby moving around, sometimes for polyhydramnios, is not fixed, is not engaged. And the reason for this admission is because if your waters were to go and a cord were to drop through, again, early access to theatres for a caesarean birth if there were going to be a cord prolapse. If baby becomes head down or breech and fixed and engaged in that pelvis, then absolutely women then do go home. Another reason could be that you are unwell medically, for example, or you are really unwell with nausea, vomiting, sickness, for example, things like hyperemesis where you're dehydrated. And from a medical perspective, your medical conditions may flare up in pregnancy, requiring admission to a hospital too. And sometimes things like abdominal pain, women will be advised to stay in a hospital until that source of the abdominal pain is found. Just of note though, sometimes there's never a reason found for certain things during pregnancy. Women's health research is still one of the most underfunded areas. And yes, we do deserve better.